Hey, thanks for coming to Larger Curves today. Make sure you smash that like button, smash the subscribe button, and ring the bell on the way in. Curvies, oh my gosh, I caught another live. Yep, sure did. With none other than Married to Medicine's Dr. Heavenly. She has been looking extra this season, extra healthy, extra svelte, really aging backwards. And if you looked at this last episode of Married to Medicine, in a confessional, Dr. Heavenly and Dr. Damon Kimes were sitting in. She talked about having her BBL. And Dr. Damon Kimes was like, "You didn't have that, did you, Ma?" And buddy, and she was like, "Daddy, you know I had that." And then she's telling us in this video all the work she's ever had done. So for all the people who've been questioning stuff, for anybody who thinks she lied to Dr. Daddy, no, there was no lies involved. He just didn't know that a fat transfer and a BBL are actually the same thing. So she brought her plastic surgeon, her board certified African-American woman surgeon on, Dr. Nia on, and we're going to listen to all the procedures she's had done, and hopefully it'll help somebody learn something about what they can have done and also learn the truth about how honest Dr. Heavenly really is. Come on now. She's not a freaking liar. Here you go, folks.
People have made comments or had questions about the procedures that I've had done. And I'm ecstatic and I'm so pleased with it that I just wanted to go live with you guys and tell y'all everything I've done, how I did it, how it went. And not only that, I want to bring in my good doctor that talks about it and doing things safely. So if we're going to, let me see if I see her. Hey, Zachy. Hey, Zachy. That's my baby boy. Hey, Zachy. I'm so proud of him. Let me see if I can find my friend. She's coming in now. I told her I was doing it now. So you have to request to be added, Nia. So you have to be requested to be added. But anyway, how y'all enjoying Married to Medicine? I just want to start with that until Nia comes in. Control your mama if she gets out of hand. Okay, what? Okay. I'm trying to find you, Nia. Nia, just put in a request and I'll hit it. And then hey, LRGA Curves, how you doing? Hey, everybody, come on in. Just requested. Okay, I don't see it. Let me see if I can see it because it's like view request. This is Marjorie and 3 others have requested. Request it again. Can you do it again? It says Marjorie. Somebody requested before you did, Nia, and now it's 3 people. Okay, maybe if I press it, I can view it. Wait a minute, let me see. You know, Mom, I need my baby boys. Accept. Are you there? I hit accept, so she should be coming in, y'all. Y'all coming on in? Listen, it's an educational video.
Hi.
Hey, Nia, how are you?
How are you?
I am doing wonderfully. I woke up this morning so thankful and grateful and looking at my new body.
Yeah.
And I wanted to tell the people about what I did, how I did it, and I wanted you to come in and explain to them what I had done because my man didn't think I had no BBL.
Right.
What he was thinking was a fat transfer. And tell me if that's the same thing or what it's considered. And I'm gonna just let you have the floor.
Well, I'm so inspired by you. You did awesome. You're one of my favorite patients, not because you share out and you go live on Instagram and talk about it and you do reels without being prompted to, because you are so excited about your results, but because you really took it seriously and you really embraced it and the journey in the way that is ideal, and that you had a lot of family support and you also had a whole village around you before and after. So I talked to your weight loss doctor before you even had your surgery.
Yes.
And we made sure we were on the same page.
That was Dr. Jada.
That's right. Dr. Jada and I talked even before you had your surgery,
right,
to make sure you were on the right path. You knew what the investment was. You knew how to protect your investment afterwards. And you've taken it seriously. You work out with your trainer, you're getting stronger, you feel good. And that's really what we're here for. We're just here to get you started. We're just here to be a toolbox, get you started, and the rest of it's up to you.
Somebody say,
I just think you can't do it
okay.
yourself. Yeah. You look amazing. How do you feel? You feel good. Do you feel good?
I feel good. And one of the things we were talking about earlier is like doing it safely, because I feel really, really good. And I want to talk about what you had to do before I could do the surgery, because I went to Dr. Jada. They did a what? EEG. They did all the blood work. Just talk about how you can do it safely. And then we'll talk about why we want to do this.
So anytime you're having anything that's a surgical procedure and you just have to go to sleep, anytime that you're getting anesthesia, we treat it like any other surgery. So it's important for us to be very transparent about the risk and very transparent about what you've had before, what your medical issues are, what surgeries you've had in the past, if you've had problems with surgeries in the past, what your expectations are, talk about pain management, restrictions. It's very important for us to have all those conversations. So when your plastic surgeon asks you about your medical history and medications, don't leave anything off. Everything is important. Don't leave anything off. We need to know. And it's not because we're going to say no, it's because we need to know how to manage you and make things safe to optimize your outcomes. Because this is something that it is an elective procedure and it's supposed to be a happy procedure. So the last thing anybody wants is a complication. So you can still have complications, but we want to make sure you're safe. So we require a full history and physical, and we want that to come not from me, but from your primary care doctor, because sometimes you forget about things. Like sometimes I'll say what surgeries you have, and somebody won't say they had a C-section because they don't think that's a surgery. Now, I should find the scar on your exam, but that's something that your primary care doctor is going to have on your list. And there's some things about medications that we don't realize is this is important to let her know. If you're on phentermine, I got to know that because I got to get you off that for 21 days before you have your general anesthesia. So we like to get a clearance from your primary care doctor. And then whatever is on your history and physical, then your workup is going to depend on where you are, what your age is, and what your risk factors are. All that stuff's important. Don't skip steps. And if somebody tells you, doesn't ask about your medical history, that's a red flag.
Right.
And if someone says, no, you're not a good candidate for surgery, don't go find somebody else that's going to say something different, because we want to make sure you do it safely. Just, really, it's all about doing it at the right time.
The one thing I want to say is it's definitely an investment, but you want to go to somebody that's licensed, that is a board certified physician. I don't know if you all noticed, but Dr. Nia Banks went to Johns Hopkins. Is that right? You had extensive training. No, this is real stuff, because you get what you pay for.
Yeah.
If you had extensive training, continuing education, all that, that's who I want to go to. Now, I get a lot of people saying they're going out of the country. How do you feel about that? Because I know for dentistry, they don't have to go by the same guidelines or rules when they get a procedure done.
Yeah, there's a lot of restrictions. That's one of the things that does make things more expensive in this country, because of the restrictions, because of the licensing. Your center has to be licensed in a certain way. Your implants have to go through certain FDA approvals. So things are more expensive here. But this is not an area that we can really save. This is not an area that we really need to bargain shop for your body. We wouldn't recommend that. You only get one body. Your body definitely is your vessel. And we need to take care of it and treat it as such. We treat it respectfully. And you're just too important.
Absolutely.
We are just too important. I can't have you go someplace overseas and come back and have a problem, or don't come back. You're just too important. We have too much to lose. Our families need us. Our community needs us. Our society needs us. So we need to take it seriously. And it's also important that you have, if I'm in your community, you're going to find me. You can find me in the neighborhood and look me in the eyes. Your husband knows me. Your friends know me. There's accountability there. And there's also any other place where you go where people know who you are and know your background story and know how important you are to our community and your family. There's a certain level of trust that we have to have as a relationship. And we're human. So when I have a relationship with you, and I understand your place in the community, then you get a different reaction from me. It needs to be that I see you. I see who you are. And then you get the best out of me. And that's important how you choose your physicians. It's a relationship, like any other doctor-patient relationship.
I want to talk about how people can find you, because we want to say that several times within the video, and I'll also leave it in the caption, how they can find you, where you're at, what's the name of your practice, and why they should come to see Dr. Nia, because I did all my research, y'all.
You came all the way to Baltimore.
I did.
I'm in Baltimore, Maryland. I went to Johns Hopkins, which is in Baltimore, Maryland. I'm from North Carolina, but I went to Johns Hopkins for med school and stayed for residency. I'm an MD PhD, both at Hopkins. I did residency in plastic surgery at Hopkins. I am the first Black female plastic surgeon to finish residency at Hopkins. I went to France for my fellowship. and then came back and started private practice in Prince George's County, but I've always lived in Baltimore. Now the practice is in Baltimore. So I'm at Dr. Nia Banks on IG, and the practice name is Art of Balance Wellness Spa, which is in the south side of Baltimore. We're inside the Ritz-Carlton residence, right in the Inner Harbor. So it's easy entry, valet parking. It's a beautiful space, of course. We have some overnight suites available. If you're coming in from out of town, Dr. Heavenly stayed at the Pendry Hotel, which is around the corner. It's one of our luxury boutique hotels in the city. So we make sure you're well taken care of. And we have all the before and after care. We have massage and facials, hydrofacial. We have sauna, steam. We do lymphatic massage. We have non-invasive body contouring. We do Botox fillers, laser liposuction. We have something like cool sculpting that's called Evolve, which is better for dark skin, for skin of color. But we do everything, a full wraparound med spa with support when you need it. So
I love it. I love it. Because you my black. And it's like, to me, I don't think people realize you almost have to be 10 times better. And that's what you're paying for. I mean, 10 times. John Hopkins trained, went to a qualified sister, I'm telling you. But let's talk about my experience. I went to Baltimore. I flew in with my daughter. Remember, my baby girl came with me, and you treated me like gold. It was like when I came in, I came into your surgical center. Everybody knew I was coming. Everything was in order. It was so organized and so nice, and they rolled me back. And then I just remember them saying, "Hey, I'll be back." And I remember you administering anesthesia. That I don't remember anything else. They put something. You gave me something. You tell me what you gave me, and then I was gone.
So the anesthesiologist, I don't do my own anesthesia, so I have that's usually what we give you first.
They gave me something before. I want to say it was a pill.
Or we probably gave you some Versed before to get you relaxed before you went back in the room, because there's a lot going on in the room. It's, for us, it's something that we do every day. There's a lot of movement, a lot of bodies, a lot of support in the room. The room is cold with bright lights, and so it can be scary. So we often give you a little Versed, a little sedative before you come back. Once you sign your consent and all your questions are answered, that you can get a little Versed. And then we bring you back in. For us, this is like, it's a military operation. And I love operating. I love the OR. It's a very zen place for me. It's like a dance. You have your team, your nurses, your anesthesiologist, your surgical assistant. It's like a dance, and the patient is there, and we've done all the work to get there. They have lost their weight. They have done their exercise. They have found you. They have done their research. They've talked to their families. They've arranged for their time off. They have traveled sometimes. They've paid their money. They did all their preoperative workup. They've gotten their medications. They signed all their consents. They've gotten past all the jitters. And now here we are.
Somebody just asked the question, do you treat all your patients like you did me? And, I don't even consider myself a celebrity, but I do know for a fact that you treat all your patients the same because you care so much about them.
Yeah. I do. I treat everyone like I would treat myself. And that it's a significant amount of trust when you have decided to let me operate on you while you are asleep. And I take that trust very seriously because it's a vulnerable position. I take that trust very seriously. So everyone in the room and my OR knows how much this patient has trusted me. I'm responsible for everything that happens in this room. Everyone gets treated the same way. And that team, they can take it the way they want to take it. But that team needs to understand that this person is very important and they're very special. Every single patient is very important. Their family is depending on me to give them the best result and take care of them. And everything that happens in this room is my responsibility. And I'm here to make sure everything is right. I'm the captain of the ship. I love that. That is why I am here. And it's quite a privilege. So everyone gets treated the same way. But there's dignity in it, and there's respect, and there's privacy. Nobody was asking you for a picture. Nobody was in your Instagram. Nobody was asking for anything. You are the patient, and we're all here focused on you today. That's what we do.
Well, I love it. One person had another question. What exactly did I get? Because I remember you drawing on my body. And you listen, guys, I show y'all. You know what I mean? I feel really, really good. I don't know if y'all can see it. But she did the tummy tuck. And then she did what my husband didn't understand. He knew I had a fat transfer. Right. But is that considered a BBL as well?
Yes,
or
it is. Mm-hmm. It's the same. So a BBL stands for Brazilian buttock lift. And A buttock lift is something that's an excisional procedure. That's kind of standard, gold standard. We take away some skin to lift the buttocks up, but the Brazilian buttock lift doesn't do that. It doesn't create any scars. It moves fat from one place that's not desirable into the buttocks, and that extra fat helps fill out the skin and helps lift up the buttock shape and helps fill out some of that extra skin. Now we see BBLs in all different, ranges. Some are very obvious and very extreme, but they don't all have to be that way.
Remember
They
what
don't
I
all have to be that
told
way.
you, Doc? I said I want my butt to look natural. And then you had different shapes, didn't you? You had different shapes. And I
Yeah,
said, Doc, don't
yeah,
make my butt big like, some
yeah.
people's. I
We
just
talk
want a
about
little bit.
squares and round and heart shape and but my signature is natural. That's my signature. And if you can walk in a room and people don't know what you had done, that's a win. That's a win for me, and that's a win for you. Everything I do, if it's liposuction or facelift or eye lift or breast lift, I want it to look like I wasn't there. I want it to look like, I don't put myself, oh, these are your boobs. Look at your boobs. No, those are your boobs. So those are yours. So it has to look right on your body. It has to be proportionate. It has to be believable. It has to look natural. It has to be sustainable. And it's all about dimensions and balance. We're just trying to create balance. We're not trying to overdo or over exaggerate anything. And also, that's just my market. My market is more mature. My market is professional. That's also my market. I'm also in DC. DC, Baltimore is more conservative than LA or Miami or even Atlanta. So that's also my market.
Okay,
Relatively conservative.
another question people have is, does their insurance? I'm sure it don't. Does your insurance
No,
pay for anything?
it doesn't. Your insurance will cover things that are medically necessary, and by any standard, this is not medically necessary. So it's going to be all cash.
Yeah, for sure, for
Mm-hmm.
sure. I just want to thank you. And I was saying this morning, can you talk about? Okay, so I didn't have this problem, but some people had the problem where they're too big before the operation,
Yeah,
and then my friend Dr. Jada comes in and
yeah,
she helps them lose the
that's right.
weight
That's
before they go in. Talk about how
right.
it takes a village, because I
That's
actually put
right.
that on my IG. It's a
It
village that
does.
helps you, right?
It does. And I love that you have your wellness village. We all need to have accountability partners and expertise. And at this point, we don't have any excuse. We have access to it. We have information. We have the education. We have the providers. But we don't have any excuse. We have to prioritize how we take care of ourselves. So that same money we might spend on a pair of shoes or a bag, you need to spend it on your wellness village. You only get one body. That's it. You've got multiple purses, but you only get one body. You need to spend that on your wellness village, right? And you had Dr. Jada. Dr. Jada has made sure that you were ready for your procedure, that we could do it safely. As your weight goes up, the results you can expect will go down. It's only so much we can do. As your weight goes up, your risk of anesthesia goes up. As your weight goes up, your risk of complication goes up. So we want you to be healthy and at the appropriate weight. Not only that, but I always ask people, what is your goal? What's your goal for the procedure? If your goal is to lose 20 pounds, that's not going to happen with anything I do. Like, what I do are not weight loss procedures. What I do are contouring procedures. I'm contouring the shape and the weight that you have, but I'm not able to help you lose weight. So we need to have that taken care of before. Some people will say, well, if I get this done, then I'll lose the weight afterwards. But the reality is that all of us have tried it. Weight loss is very complicated and it's very hard and it doesn't happen quickly. So that can be very discouraging. So you need the help to get it done beforehand. Once you have those habit sets and you have a plan, it's much easier afterwards to continue your plan. The reality is most of us, if we get what we want and I look good, we done forgot about Dr. Jada and the weight loss. Oh, I got my tummy check, I'm good. And then 5 years later, like, what happened to my tummy? So you have to get those folks involved early. So you did things the right way and you still see her. Like there's no, this is a relationship that's long-term because our battle with weight, because we're going to age, our metabolism is going to slow down, our hormones are going to change, our lifestyle changes, the kids move out, our whole diet changes. Like there's life changes that happen all the time that we have to keep up with. So you need that wellness village.
I like to be open and honest about everything I'm doing. But one question they had was, are there a lot of board certified plastic surgeons out there? Because I really don't think it is. I mean, African American, because we always gonna cater to our people. You know what I'm saying? I was looking for a sister. So are there
Yeah,
a lot of people?
there's there's a good number, but there's not enough. So you guys right now, we're about 7% of the population when it comes to plastic surgeons. But African Americans are about 15-20% of the patients that come through. So there's not enough of us for everybody. And that speaks to how we are accessing plastic surgery procedures at the same rate as the general population. So it's not like white women are doing it more than black women, or Asian women are doing it more than black women. Y'all all doing it at the same rate. It matches the population. There's just not a lot of plastic surgeons. Now in DC and Atlanta too, and we are very blessed because we have these communities, these urban environments that attract. We want to live there. We go there for medical school. We want to stay there. We like living in DC. We like living in Baltimore. We like living in Atlanta. So you're going to have a lot of Black board certified plastic surgeons, but they may not be as fortunate in Ohio or Illinois or Chicago, but in the Midwest or the South. But there are a good number. It takes some searching. So you can go on the American Society of Plastic Surgery website, ASPS, American Society of Plastic Surgery. It will list board certified plastic surgeons in your area. You can do it by zip code. You can see their
Now, I want to correct you. There are not a lot of y'all. Y'all are very few and far between, especially ones with the credentials that you have. They're not. I mean, Atlanta's a little bit different because we're the mecca of Black professionals here in Atlanta. That's why Married to Medicine is here, because we're the mecca. But it's not a lot of y'all out there. It just is not. You know what I'm saying? African American board certified, John Hopkins, done the training, done this, and had the experience. I look myself. It ain't a lot of you, Dr. Nia. It's just not.
Well, I'm definitely one of a kind. That's for sure. We do have. I'm the first Black female plastic surgeon that finished at Hopkins. Now we have a second who finished last year. So
awesome.
The second, but she didn't go to Paris. So there's only one of me. But we're all unique. But you can find us, and sometimes it is worth it to travel. But you need to make sure that you have a realistic view of downtime. Mm-hmm. And that you might need to stay in town for a couple of days so you can make sure you're safe. Mm-hmm.
How long did I stay? I stayed 2 weeks. How long did I stay? I stayed 10 days, 2 weeks.
You were here from a Monday to Friday. So you were here almost a week.
Okay.
Enough time for us to do a follow-up visit. We did a post-lymphatic massage before you went home, and then you came back. Mm-hmm. You came back about a month later. We did a follow-up visit to make sure everything was good. So we do expect, we want to see you. This is not, this is not overseas where we're sending you home and we don't want to see the problems. We want to see you because it helps us learn. It helps us reset expectations. We grow when we see our results. We also want to make sure we get your questions answered. I don't want you going to a plastic surgeon down in Atlanta and saying, what about this? What is this? I want you to come to me. So we want the feedback. We want the account. We want the relationship, because most of my customers are going to be repeat customers. So relationships are very important to me. So just like your banker, you're coming back.
Can we talk a little bit about the pricing? A lot of people are asking about the cost, the pricing, how much it will cost. Now, I say it's priceless. For me, everything that I've done and the way I feel right now, to me, is priceless. Because it just like with your teeth, it boosts your self-confidence. I feel good. I look good. I feel better in my clothes. It gave me the extra boost to get up and work out. I mean, it just was a boost. So can we talk about price?
That part. Investing in yourself is an investment that you're always going to reap the benefits from. There is no better investment. You're going to benefit from it. Your spouse is going to benefit from it. Your children are going to benefit from it. Your employees are going to benefit from it. Everyone around you is going to benefit from the increased energy, graciousness, and love that you have to give, because you feel good. Like we do so much for everybody else. It's important that we take care of ourselves. And I think in this moment, like all moments, but particularly in this moment, we can see that we can give and give and give and give and give and not really be appreciated or have the benefits given back to us. So you have to stop and take care of yourself. You're the only one that's going to do it. But so we charge by the hour. I charge for my time. This is also a good lesson, not only for pricing, but also for yourself. Your time is valuable. You have to price your time and value your time. People will either see your value or they won't, but my value doesn't change. So we don't discount. We don't have specials. So I charge $2,500 an hour, $2,500 an hour for anything that I do. So everything is kind of based on that. It takes me about an hour to do one thing. It's going to cost you $2,500. If it takes me a half an hour, it's going to cost you half of that. That's what I charge. If you're doing something that requires a facility, then we're also paying the facility, the surgery center. If you need anesthesia, IV sedation or general anesthesia, then we're paying the anesthesiologist. So anytime we need a facility and anesthesia, then we're also adding about 50% of that base cost that I charge you per hour for the facility fees. So tummy tuck takes me 3 hours. Now, if you're smaller, may take me less, may cost you less. If you're bigger, may take me longer, may cost you more. So it's all based on time.
Okay. Do you have like financing? Because I know with the dental we have financing. Can y'all finance it out? You know what I mean? It's worth it. But if you don't have the money, can I get a slow monthly payment, doc?
Yeah, absolutely. If you want to break it up, and sometimes it's just smart not to give all your cash out right away. You might want to spread it out in the payment. So we don't do financing, but we use Care Credit. Care Credit is a financing company that it works throughout the country. It's a credit card you can use for dental procedures. You probably have used Care Credit. You can use it for you can use it for eye procedures. You can use it for your vision care. You can use it for plastic surgery. You can use it for your deductibles. You charge it it's basically a credit card. You charge it, and then you pay payments to the finance company. You pay payments to Care Credit. You can choose the plan that makes sense for you. The interest rates are going to be prorated based on your credit score. Your credit score is 700 or above, you can probably qualify for Care Credit. If you're getting close to 650, it might be a little shaky. And then we'll say kind of work on that first, and we'll come back to Care Credit. But we use Care Credit primarily. People are using, flexible savings plans. It depends on your plan, but now you can use that for cosmetic procedures. You can, if you plan out far in advance, you can save your money up, put things aside in your tummy tuck fund, just like you do for your travel fund.
Yeah. Okay, so my next question is, what's the ideal age? Because I know most people that get it done are over 40, over 50, because I'm 54 and I got mine done last year, 2 years ago. Why do we, and it was too old, if you will, because
it's all about your biological age, not your chronological age, but your physical age. So if you're 70 and healthy, you're better off than someone who is 30 and very unhealthy in terms of your risk factors. That's just a fact. Like there are certain things that we do. We'll do a Caprini risk scale, which there's certain things we measure. Age is a factor in your risk for having a DVT or blood clot, but there's so many other things. Being overweight increases your risk of having a complication. Uncontrolled diabetes increases your risk of complication. If you take a lot of medications, increases your risk of complications. So we measure all those things. And if you're healthy, then you're a good candidate. If you're not healthy, you're not going to be a good candidate. And age is only one of the factors that factors in. Most of my patients are going to be 40s to 60s. That's the vast majority who are doing body procedures. And that is because I'm usually doing restorative procedures. I'm usually doing things that I'm putting your body back the way it was before you had children. Or I'm putting your body back the way it was before you gained and lost the weight. I don't do a lot of body changing procedures like I'm 20 years old and I want a bigger butt. I don't do much of that because I can't really relate to that population. I relate to the people who I do what I'm supposed to do. I take care of myself. I take care of my family. I have sacrifice. I work hard. I'm very sophisticated. I understand that I have value. I'm taking care of my body because my body is one of my assets. My body is important to me. How I show up in the world is important to me. I'm in front of people. That's important to me to show up. I'm usually taking care of those folks. And most of those folks are doing those things once they get to a certain place in life and they're able to prioritize themselves. They've spent a certain amount of time taking care of their families. Their children are a little bit older and the children are not dependent on them as much. Most of my people are not coming and getting tummy tucks right after the baby was born. They're waiting until the kids are good, the family is good, the business is good, and now I can take care of myself. So most people are in the 40s and 60s in my practice.
Absolutely. For me, when I turned 50, I was like, you know what? The world is all about me. I've spent my time and my money and my effort on these children. I've done it. I still pay the bills, but I'm just saying, I was like, let me do whatever it is I want. I'm going to get my teeth done. I'm going to get my hair done. Whatever I want to
All of
do,
it.
I'm going to get it done. And a lot of people think that you did something for my face. You didn't do anything on my face, did you?
No, that's just joy.
I ain't get no nose job. I did have Botox. I did, but the teeth is what made my face. You know what I'm saying? So it's about putting money money where you want to. It's an
Let's talk
investment, I
about
want to
that.
say.
I don't think people understand, like, the teeth are so important. It's not just the teeth, it's also the bone stock. Like, I can put fillers in your face all day, but if you have lost bone stock and don't have a full set of teeth, your face is never going to look full. Like, all this goes together. It all
We
goes
need to do
together.
a makeover together and do the hair, the teeth, and
Oh,
everything. We
you
need to
can't.
get somebody
We
together. We can
can't.
change
We
somebody's
need to do
life.
it. You can't. I can't. I can't do nothing for you. I mean, like, so I can make your body look great. I can even do a facelift or eye lift. But if your teeth are still not healthy, we're still not hitting on all cylinders. And if your skin is not healthy, so we're gonna bring Dr.
But
Jackie
you
in with
offer all
Wild
of
Med
that
Spa.
too, the facial
I can't
peels
do
and stuff.
nothing.
I
I
mean, but
can't do
don't you offer the facial peels and stuff?
Yeah,
Don't you offer
we
facials
have
and the
to.
peels? And
We have to. Because
hmm
if I can do a facelift or eye lift, but if I'm looking at, acne scarring, rosacea, hyperpigmentation, or skin that doesn't have good
Oh, we wasn't talking
elasticity of
about
God,
free. If we did something together, work together, we would still charge. We're not doing nothing else free. Y'all done messed that up for
we
real.
got
Y'all
folks
messed that
signing
up
up.
real bad.
We got folks
Right?
signing
They
up.
getting
That's the
excited
problem.
already. Getting excited. No, it ain't free. I never said
Let me
that.
tell you
Okay,
what.
so
Let me tell you something about free. People don't appreciate stuff that's
at
free.
all,
They
at
don't value
all,
it.
I would never do that
They
again.
don't value
Hmm
it. They don't see the value. And if you don't pay for it, you don't see the value. And you'll never be satisfied if something is free. That's one of the reasons we don't discount. You just don't appreciate the value. It's just a psychological thing that we have. You ain't gonna do it. But it's, as you said, it's an investment in yourself. It's so worth it. And I love seeing that transformation, not seeing the body transformation, but seeing the attitude transformation. Where people are just like, she is a boss. She already was a boss, but now she's just embracing it. You can't tell her nothing. That's beautiful to me.
And I
Because everybody
feel
wants
like 50 the new 30. Is it not 50 the new 30? I feel damn
to
good. I feel real
look
good.
heavy. I turned 50 it's December. In October, I turned 50. It's a good feeling. Yeah, it's a good feeling. You can do whatever you want. You can't say
Whatever I
whatever you want
want.
yet, but you can
No,
do
you can't
whatever you
say. I done said I can't say
You
whatever
can't
I
say
want.
whatever
I
you want.
apologize now. I don't
Nope, you
apologize for
cannot say
saying
whatever
I
you
said.
want. You gotta wait
I
till you get
can't
70.
say it. Right till you get
You can do
75. I'm
whatever
gonna
you
say
want.
75.
You can do 65,
75
65,
before you can
75.
say.
Excuse me. Fair. But you can do whatever you want. It's a beautiful thing.
I feel good.
You look
I
great.
feel
You look
good.
great.
I want to tell y'all also I've had the first of all I did the weight loss doctor with Dr. Jada. She's my life coach as well, and she did all the body work, the EKG, made sure my blood work, made sure I was perfect before I could go to Dr. Nia. Okay, then when I came back, I got the hormone pellets from her. They call BioT hormone. They give me,
Yes.
they make me feel good. The libido is high.
Mm.
The
That might be the
clarity
skin
is good.
too. That
The
might be the
skin,
skin
the
too.
libido,
Yeah.
all of that, and
Mm-hmm.
energetic. Okay,
Mm-hmm.
and then I go to Dr. Jackie because
Mm-hmm.
Dr. Jada and Jackie. That's one thing. You
That's
1/5 of
it.
the 5 people you hang around, right? They
Yeah.
stay on my weight. Dr. Jada and I go walking at
Mm-hmm.
least once a week, usually once a
Yeah.
week, and we talk. She's my life coach, but
Mm-hmm.
she tells me, listen, if you go up 5 pounds, bitch, you better go over there and see Dr. Jackie and get the Manjaro shots because I do
I
that
love
too.
that.
I don't have no
Absolutely.
secrets as far as, you know what I mean? I'm very
Absolutely.
open. I'm on reality
That's
TV.
right.
I get the Manjaro shots. Now, the Ozempic did not work for me. I don't know why, but it just didn't.
Okay.
Manjaro, it's
Yeah.
got 2 receptors. I take 1 to 2 weeks of Manjaro. I'm down 10,
Good.
12 pounds.
Mm-hmm.
I
Yeah.
feel
You
good.
need the tools. You
And
need
I
the
got
tools.
a trainer that comes in. You know what I'm saying? Dr. Jada gives me the meal plan. So if I go up, you know what I'm saying? I got the meal plan
That's
of what I
right.
need to eat.
That's right.
And I'm gonna go live with her as well, and she can go over the meal
Yeah.
plan with y'all because I want to give y'all the
Absolutely.
information. But listen, support black business. Y'all pay money for cars and clothes and purses. If you want something, don't ask for nothing free. Because I just feel like it's an investment. And I know I might be wrong, but if you really want something, you'll work for it. You'll get a
You
job, you'll
go
get
for
another job, and get the low monthly payments to get what you
it.
want and need. You know what I
That's,
mean? I
that's
would never do anything free. I felt like it was giving back to the
yeah.
community, but like you say, they don't appreciate it. They call in your office, you trying to do. But
Yeah.
anyway, long story short, positive.
Yes,
We want
yes,
to
yes.
thank
You look great.
God
Yes,
for the black professionals like yourself. Thank
yes.
you so much, doctor. I feel so good.
It's a joy. I'm happy to hear. I'm here for it. I'm here
Anything
for it.
else I'm missing? What you want to talk about? What
That's
else?
it. I mean, I really want y'all to go out and support black business, but don't be afraid to pay. I mean, if anything, right now, you can be 4 times better, as we saw in our recent election. You still don't get the win. So, if you go into
Got
Black physicians,
times.
we already know what they had to sacrifice to get to where they are. You already know who they are. You already know they're better. So don't think you should pay them less.
Right.
You need to pay them more or just as much. And make sure you
Absolutely,
take
absolutely.
so.
And then once you pay for it, you could get the man. You got the confidence to get the relationship. You got the confidence to get the job, the
Yeah.
you know what I'm saying? Start your own business because we're number one in entrepreneurship and education. So black women, I want to celebrate you guys because y'all got it going on. And don't be afraid. You know, a lot of these celebrities out here, the ones on our show, I'm going to just say it. My man, wait a minute before I start talking. They done had work done. They just won't say it. They'll say body by Jesus or whatever. And I don't know why. And my man know. Y'all could know. That's how I feel. I don't know why they try to keep it secret and they lie about stuff they have done. But I'm gonna be open with y'all and I'm gonna give y'all the education y'all need to get it done, but get it done the right way. You understand what I'm saying?
We want to keep y'all safe, and we don't want y'all to be preyed upon. I think our population, because we don't talk about things, it makes us a setup for getting preyed upon and having predatory practices, people marketing to you and not willing to take care of you and not treating you well or send you home without any follow-up and not communicating with you, no accountability. It's important for us to talk to each other so you can know what to expect and ask the right questions. So thank you for being transparent. Super important. If you're in the Baltimore area, next week I'm having a conversation just about this, right, Heavenly? On Thursday here in Baltimore at Baltimore Center Stage, we're talking about Black women in aesthetic medicine. We want you guys to have education and be informed so you know it's not a taboo. People are doing it all around you. Now, the people that you can't tell had something done, that's the best
To you,
marketing.
went to you.
That's the best marketing because we don't want it to be obvious. That can sometimes turn us off and make us concerned. Like, she looks terrible. I can tell she had something done. I don't want to be that person. But you shouldn't be able to tell. But we want you to talk about it so that people, your sisters, can learn from you and be safe and ask the right questions and feel like it's okay to talk about. I don't have to hide it because that's going to make me unsafe if I'm trying to hide it. I need support. I need people to help me
Now,
out.
what's your email? I mean, what's your website, your phone number,
Yep.
your address? How do we get at you?
I'm at Dr. Nia Banks on IG. My website is artofbalancewellnessspa.com. I have two websites and also have drbanksplasticsurgery.com. I see all my patients in Baltimore at the Art of Balance Wellness Spa, which is in the Ritz-Carlton in the Inner Harbor. Then the south side of Baltimore, so it's right off the highway. You just come right off 95 and right off Key Highway. We have valet parking, so it's easy in and easy out. Come by and see me. Check out the website, Art of Balance Wellness Spa. Check out Heavenly. Check out her Instagram lives and her reels, or check me out on Instagram at Dr. Nia Banks or at Art of Balance Wellness Spa. Art of Balance Spa is the IG. Thank you.
Doc, I want
You're
to thank
good.
you, and I'm going
Keep
to put all this
going.
down in the caption, guys. What's the phone number? Can we say the phone number?
Yes, 443-424-4080. That's 443-424-4080.
And I will post the website. It's Art of Balance Wellness Spa, right? What is it?
Art of Balance Wellness Spa. The website is artofbalancespa.com. You leave the wellness off for the website. But we do virtual consults. You can sign up online or book online for virtual consult. Or you can come up to Baltimore and do an in-person consult. We want you to have the information. We want you to be safe. We want you to enjoy your body. We want you to use all the tools in your toolbox, in your wellness toolbox, to take care of yourself.
How much
You
is the
go out there and glow.
consultation fee? How much is the consultation fee?
$50 for a virtual consultation and $200 for an in-person consultation. That goes towards your procedure.
That's really reasonable. That's really
that's
reasonable.
You're basically paying for time. You're paying for my
Right.
time. That's what.
Okay. So text me all of your website and everything so I don't get it wrong on the caption. If you could text me your IG, your websites, all of that, and phone numbers so I can put it on the caption so people know how to reach you. And guys, she's the best. I would only spend my money and go to the best. I went out and reached out, but I met her in LA. People don't realize you were on. No. You weren't Married to Medicine LA. You were.
We were going to do a Married to Medicine, DMV? They ain't quite get that off. We have, and it's true that Atlanta is the Mecca. Like, we have a good number of doctors up here, but we don't have as many as Atlanta. So they didn't get that going off. But we had that cameo appearance when you guys came up here for the March on Washington. Yeah, that was in COVID. So that was 2020. Mm-hmm. And they did a little bit of a cameo with me and a couple other of the doctors, the ladies from this area. We joined your cast at the March on Washington. We had a good time with you guys doing some COVID screening because Daddy was doing COVID screening at the March on Washington. And then I came down to Atlanta a couple times and been a part your Heavenly University. I've come to a couple of your conferences, right? So that was amazing. And I also came to the Met Gala. That was the first Met Gala last year.
You did. Well, we want to thank you for all your support, Doctor. And I hope everybody realizes why I'm doing this.
Well, thank you, Dr. Heavenly, for continuing to do the good Lord's work and sharing your plastic surgery journey with your boopies et al. So that we can understand all the really things that go into having a BBL and all the things to consider. It's not just go get the surgery. There's pre, there's post, there's during, there's things to be done. So I was really glad that she got to discuss that with us, Curvies. Anyway, leave it in the comments, smash the subscribe button, smash the like button, and ring the bell on your way out. See you in the next video.